Good evening, everyone, and happy December, happy holidays, happy almost New Year. Where did 2024 go? Another fast year, but so many exciting things that happened in the OCD community. So we're glad that you're here with us tonight. If you're joining us via chat, please enter. Let us know where you are watching from, your state or the area you're in. It'd be great to hear from you. And as always, if you have a question or want to react to something that we talk about tonight, please feel free to use that comment button, and we like to read your comments in the chat, and also, keep things live and going. So I am excited to be here tonight. Before we get started with our awesome panel, just let me read some announcements. This is, of course, the Supporting Families live chat. We do it every month. We've been here for about a year and a half, and I have to thank Jack MHA, who has been our biggest supporter, and their dedicated help here, which makes this live stream possible. So thank you, Jack MHA. As always, this live stream is educational and not intended to replace therapy. So for treatment-related questions, please work with your provider or contact a local clinician. You can use the IOCDF's online resource directory. It's fantastic, got a wealth of information and a lot of resources, and also a lot of links to therapists. You can go to iocdf.org/find-help. See it right there on the screen. And using that link, you'll be able to find a local clinician near you, or even someone who might be able to treat you via teletherapy. The IOCDF is not a crisis hotline, so if you are in a crisis, or if you're feeling suicidal or unsafe, please call the 988 Suicide and Crisis Lifeline by dialing 988. That's here in the U.S. You can also access it online at 988lifeline.org, or you go to your local emergency room. If you're tuning in from outside the U.S., I'm sure there's local emergency numbers and contacts you can outreach. So please do that first and foremost if you're feeling like you need some support and someone to talk to. And also, here in the U.S., you can call 911. And we want to make sure that this is a safe space. So please be kind and respectful. At the end of the day, we're all here to support each other. It's a great OCD community, and we're here to kind of help each other and give each other tips and advice and support. So just a note, this is a live broadcast, so we are broadcasting several social media platforms, and this is being recorded. So with that, let's introduce our panel. So excited to have some representatives from the IOCDF's YA SIG. SIG, is it channel? Is it group? SIG group? This is going to be a nice conversation. Please feel free to ask them questions. These folks who have a lot of great advice and have gone through OCD treatment themselves and are advocates, and might be able to give parents like you a chance and an idea of some of the things that might be going through the mind of somebody with OCD. So Kyle, can you kick it off? Give us a little bit of a background on your story, what led you here?
Yeah. And SIG stands for Special Interest Group. That phraseology also confused me when they introduced the term. But yes, thank you for having us on. My name is Kyle King.
Sorry. Congratulations. That's awesome. Sorry, my daughter just got into Vermont. So
we got one. Congratulations.
Yay. Sorry. It came out at 7:00. So yeah. Okay. Sorry. Okay, here we go.
And very young adult, conversation topic, college. I'm sure if anyone has questions about going through college with OCD, all four of us will be happy to answer. But yeah, so in brief, I'm Kyle. I'm one of the co-leaders of the SIG with the other three panelists who will be introducing themselves shortly. My general overview of my story is I was diagnosed with OCD when I was about 12 or 13, I think 13, in between 6th and 7th grade. Had a really rough go of ERP for a really long time because I was very afraid to commit myself fully to treatment. And I lied to my therapist, I lied to my parents, and I had a very adversarial relationship with my parents for a super long time. Ended up eventually hitting my rock bottom about 6 months into treatment, and then decided that something needed to change. And I started to really go with ERP in earnest. And by the time I was in 8th grade, I had more or less recovered from OCD. That's not to say that it's been smooth sailing since then. I've had relapse, I've had challenges as I've kind of gone from high school to college and now into grad school. But I'm currently a medical student at Yale. I should have started with that. And yeah, I'm managing OCD. So happy to answer any questions about that.
Awesome. Thank
And
you,
I'll
Kyle.
popcorn it to Jesse.
Yeah, great.
That's funny because you're on my screen here.
Yeah.
But hi, everyone. My name's Jessie. I was also confused by the SIG phrase earlier before I knew. But I've had OCD since I was 12 as well. I've pretty much had OCD my whole life, but went from therapist to therapist to therapist before finding someone who specialized in OCD and diagnosed me around age 12. And I feel like I've had like every theme since then, and it's really gone whack-a-mole. But why I care a lot about this topic specifically is because, one, the young adult topic, because obviously I'm a young adult, but I didn't know anyone else with OCD when I was going through treatment. I was very lonely and very isolated in that sense. I also isolated my parents. So I basically would go to therapy, and then like my mom would drive me. I'd get back in the car with her, and then we'd be like, so the weather, and like wouldn't talk about it at all. My parents still don't know a whole lot about OCD. And that's one of my biggest regrets going through treatment is not having my parents on board, and also not having the community. The community has made such a difference in my life and such a difference in my OCD recovery. So I'm so grateful for these three folks and also our SIG at large, and really care about like talking to others about parent involvement because it's something that I really wish I would have had. I'll pass it to Victoria.
Hello, everybody. So my name is Victoria. I'm another one of the co-leaders of the Young Adult Special Interest Group. I am also a social work fellow at the OCD Institute of Texas, but most importantly tonight, I'm a young adult with lived experience. I started experiencing pretty severe symptoms around the age of 19. I got diagnosed at the age of 20, so fairly quickly. But what I can say is that looking back at my childhood, I for sure showed definite signs of having OCD. A lot of it was around just not wanting to be around friends, not wanting to have sleepovers. But like my parents just thought, oh, that's just who she is, and we're just gonna flow with it. Looking back at it, it was all due to OCD fears. And the reason I'm so passionate about this topic is because I want parents to have that like extra knowledge of those early stages of life, of what are the signs, what are the symptoms, how can we get help, and go from there. I eventually entered an intensive outpatient program at age 20, went through that for 4 months, but just kind of like Kyle, I was 1 foot in, 1 foot out, didn't really go full force, didn't really understand what it meant to go full force. Got discharged from that program, was continuing outpatient, entered another intensive outpatient. That was a month, and I was like, I'm doing this, we're going all in. Left there a whole new person. I can proudly say that I've almost reached that freedom point, right? There's still work to be done. There's always work to be done with OCD, but I've really come full circle and now am a clinician in the field. So I'm going to pass it on to Sydney.
Hi, everyone. I'm Sydney, the fourth co-leader of the Young Adult SIG, as we've all said. I had symptoms of OCD probably starting around age like 6 or 7 for as long as I can remember. But most of my compulsions were like mental compulsions. They were inside, and I really hid all of my suffering and distress from my friends and family. I wasn't diagnosed until about, I think it was age 20. I had taken a leave of absence from college at that point because my mental health was so severe. And that's OCD, depression, and also PTSD. I was just not functioning and not really engaged in my life at all. By 21, I had started ERP treatment with a lot of motivation and pushing from my mom, which is why I love talking about like parent involvement. She really was one of the main reasons that I got into treatment, that and the IOCDF. I did ERP for about a year, and I saw immense progress, life-saving, life-altering treatment. And now I am working on going back to school, finally feeling more like stable in my mental health.
a variety of experiences here, different interactions with parents. I think I definitely want to jump right into that. But I do want to follow up with each of you and ask, what made you, was there an event? Was there something specific, or, what made you want to kind of give back to the community, join the SIG, speak out, do things like this for the OCD community?
I can
we'll
start.
Yeah, sure. Victoria.
So the first time I realized that I wanted to, well, first becoming an advocate and becoming a clinician kind of came at the same time for me of when I knew I wanted to do this. But I was in my first treatment center and I just saw how much success there was with ERP treatment, and seeing like all the other patients in the program just grow and become themselves and their personality came out, and just kind of looking up to those clinicians, I was like, I think this is what I want to do. Along those same lines, it's when I started watching IOCDF live streams with Liz and Chris Johnson, and really kind of dove into that and was like, whoa, that is so cool. How do I get more involved in it? I found out about the IOCDF conference in Denver back in, was that 2022? I think that was 2022.
Yeah.
And there was a meeting that was a young adult special interest group meeting led by Kyle King. And I was like, oh, I wonder what that's about. And I went to it. I introduced myself. Kyle will attest that was probably the most awkwardest introduction I've ever given. And he invited me into the room and he was like, hey, let's join the SIG. I'll put you on the email list. And the rest is kind of history. Just became more involved with the SIG, started developing new initiatives, became a co-leader, and I haven't looked back. I love advocacy work. I love giving back to the community because no one should struggle with OCD, and whatever we can do to share our stories of hope is what I live for.
Love it. I mean, it's great that that kind of in-person conference, you found your way there, and then it kind of helped you blossom. And Kyle had a small part in doing that. Yeah, Jesse, how about you?
Yeah, so I wish I would have been brave enough to go to the in-person conference sooner, because it is seriously like the best weekend of the year. But I was actually watching a lot of live streams and stuff from the IOCDF, like kind of silently and like alone and like away from everyone, kind of in secret, because there was so much shame and so much stigma around mental health and around OCD from my upbringing that I didn't feel like I could tell anyone. And it was kind of this like secret that I had. And I would watch Ethan Smith and Liz and Chris and all these amazing advocates. And I remember thinking, like, why am I being so secret about like this? They're so cool. Like, if they're so cool and I look up to them, why would others look at me differently? And it actually happened. I didn't mention this, but I'm also similar to Victoria. I'm in grad school to become an OCD clinician. And I was writing my grad school essay, and it was about stigma. And I was like talking about all this negative stuff about stigma. And I was like, I'm such a hypocrite. So that year I decided during OCD Awareness Week, I was going to like post on my public Instagram of maybe like 100 people. Like, it wasn't this big thing, but I was kind of like coming out to my friends and family about my experience with OCD because of those other advocates. And it has been the greatest decision. This community has been amazing. And it's really neat and really fulfilling to see other people with OCD. We have like, I would say a decent amount of people who like haven't met anyone else with OCD who will join the Young Adult SIG, and to like see the like widening of their eyes, like when they come in and someone will say like, I had that thought too. And it's just a pretty incredible experience. So it's been incredibly rewarding.
I love that, you kind of started it as like a lurker looking around, like getting the information through online, and that slowly, that became the kind of instigation to say like, okay, I'm going to post about it. And now
it sounds creepy. It was a little creepy,
but it's great. There are many with that story. Yeah. I think it makes sense. And it also, then you decide to jump in, and now you're like, I'm all in, and wow, what a wonderful community. I should have done this sooner.
Exactly.
Okay, we got Sydney and Kyle. Who wants to take it first?
I can go.
Okay.
Similarly to Vic and Jesse, I was watching a lot of the ISDF live streams, and I remember that, yes, my mom was a big part of me getting treatment, and one of the reasons why I eventually agreed to that is because hearing like Ethan's story, Chris's story, and being like, okay, if they can do this, maybe I can do this too. And really being able to give back to a community that has brought me such love and growth is just so rewarding. And it's also just something that I really love to do personally. I love advocating for people who maybe haven't found a voice yet, or from something that I previously felt like I had no voice. I could have never imagined talking about OCD, and then being able to have that growth and come on like a public platform and talk about it is just, it's so rewarding for me. And I love helping people. And if there's a chance that one person is helped by what I say, then, you know, it's all worth it.
Absolutely. Love it. Glad you're speaking out.
I'm gonna answer the question slightly differently because I agree with what everyone said. I just want to instill hope and all that. But I wanted to talk about like why I like focusing on parents specifically, and like want to do a panel like this, because so in the initial stages of my treatment, my parents like weren't involved essentially at all, and that's like not because they didn't want to be. It's because their therapy team like wasn't involving them, and they really were like trying their best to understand this condition, but they just weren't being really integrated into my care. And then kind of as they started, and then they kind of started to be integrated more into my care. And I really don't think I could have recovered had it not been for my parents, and for like them being really into reading and learning about OCD and helping me move through all these exposures. And I just feel like the system doesn't prioritize talking to parents and like empowering them and telling them like, hey, like you can be a super meaningful part of your kid's treatment program. My parents like definitely saved my life on multiple occasions. And I also know that like my parents felt probably just as much pain as I did while they were going through it. And they spent so much time taking care of me that I feel like they didn't take care of themselves. And I certainly never was like, hey, how are you guys dealing with one of your kids really struggling? Because I was going through some stuff at the time. So it's like it's a community of people whom I feel like personally like beholden to. Like I wouldn't be here without my parents. And I feel like they don't get enough love and support in this community. So that's why I wanted to be here and advocating on this specifically.
All of you here are the help you're offering, and I think that perspective and point of view is really important because, Kyle, to what you just said, there is, as speaking as a parent, it is kind of like, how can I help? I don't know how to help. There are roles you eventually, like we realized in ourselves, like, oh, I could be a cheerleader, I could advocate, I could help, open door, not open doors literally, but like get the
definitely metaphor
that my daughter needed. But it was a hard realization to be like, oh, I can't make anybody better. I can't make Vanessa better. She's got to work on it herself. And that was very hard for us to realize and deal with. For me, I just want to say that like there was so much help and support that I got from the IOCDF, from therapists, from the community, that I felt like when I got to a point where I could talk in a knowledgeable way, I felt like I had to give back. And, that's really why I'm so glad that I was able to pick this up. And that was the impetus behind Unstuck, the OCD Kids movie that we produced years ago. And some of the conversations I've had with a lot of young adults who are now young adults now said to be therapists and involved, have moved on in the world, or having kids and families and getting married, and it's wild and great to see. Let's talk about a few of you mentioned kind of like feeling this isolation and not really being aware of what's going on. What was your relationship like with your parents and your family's caregivers at this time, and how much was OCD inhibiting and kind of getting in the way of how you were just being involved with your family? Sydney.
Yeah. Did you want to go first, Kyle, or you
No,
just?
I'll go second. It's fine.
Okay.
Word.
I first. Okay. I think that my OCD heavily impacted my relationship with my mom. I was I was like a shell of myself. It was not me showing up to the relationship. It was purely my OCD basically, and I was totally disconnected from myself, from the real world around me, from my mom. Anything from like just not being like myself to actual compulsions getting in the way of like, oh, I wouldn't sit on the couch with her anymore. I wouldn't get physically close to her, and my mom not understanding like why are you doing these things? Because for a while, I did not want to talk about it at all. I was very anti-talking about it. I was very shut down, or I was like, it's OCD, and I don't want to explain. And through treatment, and once I was able to kind of reconnect with myself and realize who I was outside of OCD, that kind of helped me bring that relationship back with my mom. I think that if I had opened up sooner, that I might have felt less isolated. And a lot of it was self done because I thought that that's what I needed to do. But I think looking back, it would have been better if I had talked to someone sooner. Kyle?
Yeah. So my relationship with my parents just like hit the fan when I started to go through treatment, and it's for a variety of reasons. But the I think the biggest one was just like I mentioned, my parents tried to learn as much as they could about OCD, and they were able to understand the disorder a lot quicker than I, as a 12-year-old, was able to. So they were very good about saying like, okay, we have our son Kyle, and then Kyle has OCD, but those are separable things, right? But in my head, I was like, no, Kyle and OCD are the same. I couldn't untangle myself from it. So my parents were really big into like, I'm not going to accommodate. We're not going to literally open doors. Rather, they'll do it metaphorically. And they would tell me like, we're not going to accommodate. We're not going to make this food that your OCD wants. And they would use that language. Like, we're not going to do this for OCD. And that would make me really upset and anxious because at the time I couldn't disentangle myself from my OCD. So when they said, we're not trying to hurt Kyle, we're trying to hurt Kyle's OCD, I thought they were just hurting Kyle. And I got really resentful and angry and upset. And we certainly had a lot of nights where we just wouldn't talk. And then eventually, as I started to do more exposure therapy and built up more insight, it became clear to me that like, hey, these people, despite not feeling like it all the time, are really on my side. And like, they're here to help me. So eventually we kind of got past that and started to build a relationship around fighting OCD together. But it certainly took some work in the beginning.
No doubt, I can definitely connect with what you were saying. That making OCD a third person was something that we definitely used. Like, we're not doing this is your OCD talking, that type of thing, that language to make OCD a thing that was outside Vanessa. So yeah, that's a good parent trick.
Yes, good parent trick. I endorse.
Yeah.
Endorsed by Kyle King. Yeah, I wish I would have had that from my family. I think a lot of it is on me too for being really secretive about my OCD. I think isolating is the exact word to describe my experience. My older brother's autistic, and so it was always kind of like, let's make sure Jake's okay, and like I was like the okay child while he was the one that they were like talking to the school and trying to figure out an IEP and all of that. So my parents really had no idea. Like, they knew I was going to therapy, but they didn't know anything else. So they would be asleep, and it's kind of weird because like I'm home right now back from grad school. So like I'm in the house where all this happened, but they would be asleep like at night, like when everyone goes to sleep. I would start doing all of my rituals of checking every door, checking underneath every surface, like making sure I wasn't going to get kidnapped that night. And they had no idea. Like, I was pretty stealthy. Like, I was quiet. They knew I would ask questions. They would give me reassurance. I was like accommodated up the wazoo because they had no idea what OCD was. So things were like getting worse as I was in therapy. And I didn't mention any of it. And I had absolutely no idea to even like think about bringing them in because it was never really an option. As Kyle said, my treatment team didn't really talk much to my parents. So it was kind of like, oh, why bring them in? They got it. So it was a really kind of bizarre experience where I was having this whole other life as a 12-year-old for many, many years that they just had no idea. And it's actually interesting now that I'm becoming a therapist, there's a little less stigma and my family's a little more open to talking about things. And so they're now realizing about accommodation and all that stuff. And it's very interesting to kind of see like the light bulb go off in their head of like, wait, when we said like, see you tomorrow as a kid for like 15 years, like that was accommodation. So it's been very interesting, and there are definitely a lot of regrets throughout that process.
Jesse, if you don't mind me asking, when you your treatment that you said your therapist or those that you were working with didn't want to involve your parents, was that were those OCD therapists, or did it take you a while to get to like an ERP therapist?
It did take a while. This was an ERP therapist, and I don't think it's that she didn't want to include my family. I think it's just that I was so against it because I still wanted to be this like perfect child that wasn't like a bother. Like they already had this other son that they were dealing with. And so I just wanted to be this like perfect kid that wasn't experiencing anything. And so I was really against any time my parents were to be involved. So I don't know. It would be interesting to talk with her about that, but I don't think she was against including my parents, but I was like so against it that she followed that lead.
And she was working on building trust. Yeah. So there's a good amount of chatter going on in our comments. So I appreciate that. And some of the folks, clearly some of the things you guys are saying are connecting. There's a question. I'm sorry, I'm probably going to mess up the name, but I think it's Mahosh. How do we approach family support when the source of the trauma might be somebody in the family itself? So the OCD either may be somebody in the house, or one of your family members is the trigger, or might be causing you to have those obsessions and compulsions. So did anybody have that experience, and how did you work through it?
I can definitely talk to that a little bit, and then let Sydney take most of it. But I kind of wanted to touch on the last question as well.
Sure.
And it kind of like flows into this because my dad was one of my biggest triggers. And hi, Dad, if you're watching. But like for some reason, you were just super contaminated. I did not want to go near you. And he really, when he got home from work, I had my spot on the couch. I sat there. He had to sneak up through the basement, drop his bag. My mom had to clean the entire bag. He went straight up to the shower, took a shower, came back, still wasn't allowed near me, right? Like I was so protective of myself. And now granted, I do want to add in like a huge point here, because the one thing I love about the four of us, how we have different stories, is everyone's different. Everyone's experience is different. And I will say that my family accommodated me to the max extent. But what I will say is that they didn't know, right? They didn't know what OCD was. They didn't know what they were doing. They just saw their child suffering. And nobody wants to see their child suffering. So they were able to jump in and help in any way they can. But once they got more involved in my therapy and they learned about OCD and accommodations, they were able to reduce those. But the one thing I'll say about my dad being a trigger is that made me feel so isolated, to the point where I felt like I only had my mom and I can only trust my mom, and that I wasn't able to go to my dad for anything. And he had to stay far away. It was almost like I wanted him to move out of the house. Like it was that to that extent. But what I will say with effective treatment, with my therapist, including my family members in treatment, which they've done from day one, which super thankful for, we were able to reduce those accommodations. I did exposures. I was able to hug my dad. I was able to have him sit next to me on the couch. And that's what brought the support back. Thanks for the clap, Kyle. But that was kind of my experience. So definitely very challenging. It wasn't necessarily like a trauma based. I'm gonna have Sydney talk more about that, but it was more or less of a family member being triggered. Why? What was so funny about that?
No, and nothing's funny about it. It's just like I'm just like laughing at like, oh, like yeah, you got
It's like
trauma.
Sydney's got the trauma. You got this.
As a disclaimer, we all know each other's stories really well. So
Yes. It's you know what's coming before it comes.
Yeah.
So I'm going to pass it on to Sydney to answer the rest of the question.
Yeah, as someone who has PTSD, and a lot of that is surrounding family situations and family members. I definitely have had this huge overlap between like PTSD and OCD, and it's super tricky to parse out. And you're right, it is like a different challenge at times. What I would say is if you're still in like that family situation or a family may be the cause of trauma, obviously if it's something ongoing where you are like unsafe or actively being harmed, I would say to try to leave that situation. And if that's not the case, maybe things happened in the past and it's okay now, I'd really recommend maybe trying to seek trauma treatment as well. That has been very helpful of like working through some of the trauma and working through the OCD. And it can definitely be different when you have this trauma of like learning to trust people, your family, especially if they were like there for parts of the trauma. I will say that there's a lot of new resources out there for like PTSD and OCD overlap, and I would look into that. There are some providers who do those two disorders overlapping specifically. Did I just freeze? It like froze on my end. Okay, no, never mind.
No, gotcha. Yeah.
I just want to acknowledge that it is very difficult, but working with your therapist can also help you like learn how to talk to your family about these kinds of things.
Sure, and then figure out ways to like bring them in, or when it's time to bring them in, or how you breach those conversations. I'm sure, Victoria, I don't know if you had a an exposure or hierarchy with your dad, and you got your dad's buy-in to what step one was going to be versus the actual getting up to the hug and sitting next to you. So all of you mentioned different times when you were going through, or either before therapy, during therapy, or when you started therapy, that there was a bit of resistance, or you were fully against and you were lying to your parents about what you were doing. And I think that connects with a lot of parents, because there is this need to say like, okay, as a parent, I have found you a great therapist. This is what we're going to do. I know this is the plan, and you're bought in. And then the parent and the caregiver or the sibling can't actually, force you to do something. You have to do it yourself, which is why certain programs like the SPACE program, and helping parent accommodation have been really handy. But what were the moments that kind of helped you go, you know what, I have to really get involved in this. Sometimes for younger kids, it's easier with like, oh, we'll give you an award, you earned something, and that can be a motivator. What, as teenagers and even young adults, what was that kind of motivation like? And I think your insight will kind of help parents understand like what might be going through the mind of their loved ones, so that they can kind of approach it in slightly different ways, or have a better understanding of like what those motivations are. I'll throw that to anybody in the room.
You got to pick one person to start.
Kyle.
Ooh.
You spoke first. See?
Yeah, that's fair. That's fair. But I know we all have thoughts about this, so I feel like we're all just gonna wait until someone says something. I think like in terms of what I could say that might be like insightful is okay. So like what took me so long to kind of break out from my to throw myself into ERP, and I've kind of alluded to this a bunch already, is like me and my OCD felt really conjoined, and I thought it was really trying to protect me. So what helped me kind of turn that was having kind of a cognitive shift in which I was able to recognize my OCD wasn't protecting me at all. In fact, it was the whole reason that I was so frustrated and so mad and so unhappy all the time. like it's being this external entity that I, externalize in my head, was this really bad thing that was causing all these really bad things in my life. And what my parents did that was really helpful and like helped me buy into therapy was my mom in particular would like tell me like all the time, like way too often as a joke. Like, Kyle, like, essentially like, don't you wish you could touch your phone? Like, it's OCD is the reason you can't touch your phone. And she would like remind me of all the things in my life that I used to find like that provided meaning to my life. Like hanging out with friends, touching my dog. And she would like tell me very explicitly, like, you know why you can't do this stuff? It's because OCD is not allowing you to. And she helped me make that connection between OCD and all these limits on all the things that made life worth living. I should put a big like caveat that worked for me because I respond to like very hard ass parenting.
So
but
actually, that was what I was going to say. Was she tough about it? Or was it joking, or
No.
just like
it was
she was
serious.
being like, "This is okay."
Yeah, it was dead serious, and it worked for me. And I'm not saying you should go out and try that right now, but I think the general principle of like, talking about kind of what OCD is taken from you and reflecting on that, maybe it doesn't have to be as combative as I just described it, is really helpful in like thinking, oh, like I do need to get on top of this because this is causing me a lot of pain and strife, and this is something worth fighting.
So like I'm taking out of that, that worked for you, your mom at being like really tough with you. And what I take from that is like, as a, for parents and caregivers out there, kind of what your child might be motivated more, what they like, what their personality is. And rather than necessarily like doing what you as the parent feel they should do and, telling them the way it should be, interact with them the way you feel like might motivate them or be interested in them. My daughter is extremely sarcastic, and so those type of things would work, and that personality and that tone would work with her. And so that's like find that way in it, and that might help. Sorry to cut you off. Sid.
Yeah. As similar to Kyle in ways, I was very stubborn. And my mom and I still talk about that, how I have a stubborn streak sometimes. Really a lot of values work really helped. My mom being like, for example, I had a lot of compulsions around my family, and I was like, I'm keeping you safe because I value and I love you so much. And my mom was like, you say you value and you love me, but like you won't sit on the couch with me, you won't spend time with me. You say you love dogs, but you won't like cuddle with your sister's dog, things like that. And it was hard to get through at first because I was like, no, you don't get it. Like, trust me, there's a 0.001% chance that I'm right, and I'm taking that. And then I'd say the other thing that kind of ended up being necessary for motivation for me to start treatment was kind of this ultimatum of sorts of my mom being like, okay, like, you're really severe, you're not eating, like if you continue to not eat, we might have to hospitalize you. And then I was like, okay, well, I don't want that, so fine, I'll try treatment. Like, okay, you caught me. But the values interviewing definitely helped me actually, once I started treatment, be able to like actually engage in it and not just like white knuckle or kind of lie my way through it.
Speaking to what would motivate you and what would help you, and also I guess that little bit of like, well, I want to take control because I don't want to go into this, I don't want to go to the hospital or be forced to eat. I have to take control of it myself. So we got two different angles there, which is great to hear. So parents, I hope you're writing this down, getting some strategies here from our experts. Let's go to expert number 3, Victoria.
Yes. Oh, why am I number 3? So
I'm 4.
You're 4, huh? What I'm gonna say
Not
is
in priority order.
not okay. Good.
Obviously,
Just in
because
number.
otherwise.
Just in 1, 2, 3.
It was a team effort. It was between my mom, my dad, and my brother. They all played different roles in that motivating factor. My mom was very much there to sit with me and educate me and like watch live streams with me and discuss it and really be a part of my learning process. my dad was very much there to cheer me on and be like, I know that I can't get near you, but like, I'm cheering you on from a distance. I believe in you. Like, I have faith in you. And then my brother was the harsh one of the family. Whenever I would call him, he would be like, Fit, what's going on? Like, keep going. What are you complaining about? Like, we don't got time for this. And that was kind of the combination of those three was really what got me as that, okay, well, I have everybody on my same team. Like, we're all in this together. How can I fight against that OCD with the support I have behind me? And I know that not every individual living with OCD is going to have that much support, but that's why it's so important to find that community and build that support behind you, because there's going to be cheerleaders that when you're going through ERP treatment, it's hard, right? It's difficult, but having that support system behind you, that community to cheer you on and keep going. But yeah, that's basically the team approach. Everyone had their different kind of aspects, whether it was educating with me, reminding me of my values, kind of giving me encouragement, or just saying, I'm not going to deal with this and you got to keep moving on.
Combination of the three and your own motivation kind of helped you, make you strong and push you to get that treatment. Awesome. Jesse.
Yeah, my answer is really different from everyone. By the time I finally got into ERP treatment, I was like guns a-blazing, ready to go. Like, I was so miserable and so done with my OCD that I was like ready for the ride. And so I remember like writing out the list and like doing an exposure hierarchy with my therapist, and like we would just like knock it off. We were like boom, 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 and we were just like doing it. Of course, she didn't know at home I was like getting accommodated all the time, but I was like ready to go. The one thing that I think would have really helped that I didn't have, obviously, like the support would have been helpful. But the one thing that I really wish I would have had was more vulnerability from my parents, because whenever we did talk about OCD or something was brought up where we had to talk about OCD, it required so much vulnerability and so much strength for me to just like get it out, because I was the only one doing it, that it was really hard for me. I remember my dad once saying in one of these conversations that he was like, yeah, I think your uncle like knocked on the door like twice one time and like felt like he had to. And I was like, really? Like that like changed it for me. I was like, no way. And my mom was like, my mom was like, yeah, I like once felt uncomfortable in like a group setting. And I was like, really? Like even just like the little ounce of vulnerability. And my parents are amazing. I love them. We're very close, but that was just not there. And so I think that would have made such a difference, because even after hearing like those two tiny snippets over like 20 years, I still remember those two snippets because they made such an impact on me. So I think that's something that parents can, it's hard. Like it's not something people really necessarily want to do, but I think your kid is being asked to be so vulnerable and almost being required to be so vulnerable that it's helpful for them to see that they're not alone in that.
Yeah, you can join in. I guess, we try to have solidarity with Vanessa sometimes. It was like she was working on this, so then it would be like, okay, I'm going to try to work on something that I don't like to do, and it would be like, I hate mushrooms, so I'm going to eat a mushroom, I don't like doing this chore, so I'm going to do it, or something else. So it's just a little solidarity. But Jesse, you made me think of a question that I feel like. So you were all hard at work on your exposures. You were kind of, working on getting your own mental health in a better place. What were your family's, parents, siblings working on while you were doing that? Were there anything that your therapist would give them, or that they were reading about, or they were working hard to do, or they had a job that they couldn't do because, of accommodation?
The only thing that they really couldn't do, and I think they genuinely didn't know that this was OCD, because it's all like entrapped with like the alarm and the kidnappers. But I had this idea that like I had to be in bed by a certain time. Like we couldn't be like out in the dark, because it didn't even make sense, of course. But we would leave things really early. We would leave any sort of gathering, all the holidays. I would be home, like in bed, like ready to go for bed, like bed until I started like moving all around the house. But my parents never went on date nights. Like they were not allowed to like go out on any dates. I would really flip if like we had a babysitter, which we had very infrequently. Actually, the one babysitter we had was this like high school boy who locked us out of the house when we were playing basketball. So like that never happened again. And my parents were like, "We're good with the no babysitter thing." He was like a high school boy, which is kind of unfortunate for them. They're like one experience. But that's something that really has been hard for me too, is that my my mom knew everything about autism. My parents knew all this stuff about autism. But like maybe I've read one book on OCD in 25 years at like my request more recently. So that's something that has been challenging, is because there wasn't that like education. But of course, a lot of that is because of me. And I was like, no, like we're not going to talk about it. So yeah, definitely a weird experience.
Anyone else? What were you?
When do you guys go? I texted my dad and asked him for book recs because there's one book that I know he really loved and I forgot the name of it. So you guys go.
Well,
I will say my mom read Shala Nicely's.
That one.
Ooh.
That's a classic.
Yeah.
And The Family Guide to Getting Over OCD by Jonathan Bromlitz. Really good one.
Yep.
Not me.
It's funny how we're all like looking at our bookshelf. Yeah.
Yeah, my dad's not responding to me, so I'm just gonna start talking. The job that they did though was like they took it upon themselves to really educate themselves about OCD. Unlike Jesse's situation, I couldn't hide it, and I was like just completely despondent and totally reliant on them. So like they knew everything by proxy what was going on with OCD, and they like really threw themselves into learning everything they could about the disorder, which helped immensely because they knew like really quickly to not accommodate, and they knew really quickly what ERP was, and that it wasn't good, that I was initially going to just a talk therapist, so on and so forth. And also Jesse, one of the things Jesse said reminded me that my dad promised that if I finished ERP, this is 10 years ago, that he would jump out of a plane because he's scared of heights. And he has never done that. Which is
happy to do it with
after
them.
this.
It's
I
fun.
would do
I think
that.
we're going to call him up after this.
Yeah, that's kind of ridiculous, right? I had to face my fears,
Two books. Because We Were Bad, by Lily Bailey. It's fantastic. And I think it's called Pure, which Rose Brecher made into a TV series on HBO. But Pure. Yeah, I found it really, as a parent, I found really kind of both are autobiographies, but really, really great.
And Is Fred in the Refrigerator by Shala Nicely. Another autobiography. So good.
Yeah. Okay. So as you're fast forward, you're all in treatment. Things are starting to get better. Did the ways I'm talking more about you're going through treatment. The ways your families were supporting you change. Were you giving them more, teaching them more about what was better for you or helpful for you or not helpful for you, and how were you active in helping them be better support for you?
I can
Sydney.
Yeah, I can start with this one. I think that it definitely changed. It started off with, I did not want to talk about OCD with my mom or my sister. It was like, maybe I'd say a sentence or two, and I'd be like, I have to wash the dishes 3 times because it's my OCD. And then like not talk about it at all. I'd be like, no questions are allowed to be asked. That's all you're getting for the next 3 weeks. And then it turned into me slowly like talking more and more about, oh, well, this is why I want to do this thing or XYZ. Personally, there wasn't a lot of accommodation in my family, mostly because I kept everything inside and I didn't want anyone involved. but there were maybe like a few things / just as I went through treatment, I just became a lot more independent. Like I was able to regulate my emotions better. The like one big accommodation that was done was like I wouldn't drive, so my mom would drive me places. And now I can drive a car by myself. And really just coming into my own and not looking to my mom for as much like reassurance or just kind of like coming into my own as myself. And that involved me talking to her as well about like, oh, this is what is actually going on. And now I can talk about it very casually and be like, oh, I just had an intrusive thought about this and I don't want to eat dinner, but I'm going to, or something like that.
Yes, I can jump in next. Oh, Chris, did you want to?
No, I was just going to say, so that more of you were having more of a conversation about how things were going rather than like a parent telling a child. This was more like you're on the same level and this is what I'm going through. Great. Sorry, Vic.
Yeah, no, you're good. Yeah, a lot of the work that my parents did in supporting me was learning about family accommodations and how to reduce them and slowly developing a plan to reduce those accommodations. But there's one thing in particular that really helped me, and recommendation by Mr. King. But one thing that really helped me.
That's a great book.
Kind of.
Text me back.
Yeah.
Now I gotta buy it and see it. Well, read it. One of the things that goes back to Kyle's like point of separating your identity from OCD is my therapist told my parents that and I texted my mom to get the exact picture of the sticky note because I'm like, this is priceless. She still has it to this day. And he said that when Vic comes and asks you any kind of reassurance question or tries to confess or does anything that is reinforcing that OCD cycle, respond with, hey, Vic, do you realize it's OCD that's asking for reassurance? Like, I want to talk to Vic. I don't want to talk to OCD. And that was that phrase that just was there. And that was her support, right? Because it was breaking that cycle. It was saying, Vic, I don't want to talk to OCD. I want to talk to you. And that's where most of it came from. So that was beautiful. I love it.
Yeah, kind of pointing it out. The job was pointing it out to you. Hey, who's asking the question?
Yeah.
Yeah. Awesome. Okay, we have a few more minutes left. I want to get to one more question, which I think is something that parents struggle with a lot. So my child, my young adult, my teen is not motivated to engage in ERP. How can I help them? Each of you have kind of had that inflection point, or maybe something you realize that I think Jesse, you had mentioned like I hit a point where I was just like, I'm going to do this, so as a parent, that's hard when you want somebody to get better, but they have to do it themselves. So are any suggestions on how a parent can help them?
I think something that was really motivating for me was getting involved in the community. And I know not everyone is ready to be involved in the community. I was not for a very long time, but it's been really helpful in my recovery to then be able to Sydney and I will text. We have similar obsessions about spiders. And so we'll make jokes of it or make light of it, and to have someone else that is kind of right there with you on the journey is really helpful. It's also helpful in an accountability sense, because sometimes when I really struggling of do I give into the compulsion? Do I not? I think about other people in the SIG and how would Kyle feel if he saw me giving into this, or how would Ethan Smith feel if he saw I had the chance and then I just gave into this compulsion. So kind of thinking along those lines and kind of externalizing it in that sense has been really motivating for me. And I know as a parent, you may not be able to provide that same lived experience, but you can lead your child to someone who does have that same lived experience. And I think that's really powerful.
It's a great suggestion. Yeah. Getting them to find that community or find that person or find that book or, that introduces them to those who are, going through something similar.
Yeah. Kind of following off of that, Jesse, a big thing that got me motivated was hearing other people's success stories. And there are so many success stories and videos on the ISBF YouTube page that you can go on. Ethan Smith, Chris Johnson, like they're all there to really provide that hope, that support, that community based. But ultimately, and this is going to be so hard to hear, and I know that I had to hear it when I was going through this, but the motivation has to come when your child's ready to do treatment. Because overall, treatment's not going to work if your child's not motivated to engage in it. It might even just make things worse, right? And what builds that motivation? It can be a range of things. It can be reading, it can be listening to podcasts, watching stories, like joining SIG communities, like anything of that matter. But ultimately, like the one message I want to send out is that it really has to come from the person that's living with OCD. And that motivation to be willing to do the work, because this work is hard. It's not fun. It's hard. It's exhausting, and you have to put 2 feet in to do it.
So then, Victoria, would your recommendation be like if a parent is really trying to help, and their person with OCD is resistant or doesn't really want to get therapy, it's like don't waste your time to do that. You should help yourself, or find other ways to give them support, but they have to find it themselves.
So I don't think
what you would say.
Yeah, I don't think that you have to completely like leave them in the dust and not help them find the support. Like you can definitely like guide them in the right direction. Ultimately, like help whatever questions they have, or if they need help reaching out to a provider, like go from there. But in the end, I mean, it's pretty much what Space, that book you were showing, Supportive Parenting for Anxious Childhood Emotions, is. It's a very parent-focused treatment, but the child's the client. So it's like, get the support as a parent of how can you help your child start to
modeling that behavior.
Model that behavior, model reducing accommodations, not giving in to these fears, doing hard things. And really your child's going to see that and be like, oh, that's what treatment is. Like, let's do it. But ultimately, I don't recommend giving up on them. They're there, like, support them, love them, really be there for them. But ultimately, you also have to take care of yourself as a parent or caregiver as well.
Yeah. I think Vic and Jesse both said great things. I would echo the modeling and the like hearing success stories. I'd also say like maybe learning more in depth and like teaching your kid more in depth at what ERP actually is, because I feel like it seems terrifying, and I mean it is, granted, and it might not be terrifying in the way that people think. Like we did a live stream in October where like we did exposures live, and I felt like that was really fun because like you could see that it's nothing like crazy that you can't put on the internet. Like it was very regular things that were exposures. The other
ICDF did not take it down.
Yeah, the ICDF did not take it down yet. We haven't. It hasn't been reported.
Claims pending against it.
And then also just like Chris Tronson said this one, so I can't really take credit for it, but I heard him say it, and I was like, "That's so good," so I'm gonna steal it.
He doesn't need credit. He's fine.
Yeah, I came up with this all by myself.
Yep.
It's not focusing on like getting to the ERP, but like what is one thing that OCD has taken away from you that you really want to do? Is it playing video games? Is it seeing your friends? And like focus on that instead of being like, you need to go do this big thing and eliminate like all your compulsions. Being like, motivate your child to be like, what is the top thing that you really miss, and kind of like work towards that.
Yeah, I was gonna say something to like that effect, because that's very acty, and like ACT helped me build up the motivation. Which is just like identifying like what you find valuable in life and how OCD has gotten in the way of it. And like that provided enough internal motivation for me to want to go out and fight it. I think another thing, because I already kind of said that answer, so it's kind of a cop-out. My parents, they would be very like explicit with me about how my situation was affecting them. Again, I don't think that's for everyone. But like them being very open with me about like how the treatment was like taking a toll on them motivated me a lot to be like, damn, like I'm not just in this fight for myself. I'm in this fight for my family too. And that made me want to fight more. No, I can very easily come up or think of a hypothetical kid who that would work terribly for. So again, very personal, but yeah, hypothetical kid. I mean Sydney, but
Yeah, there are I think what we've heard from these 4 responses is there can be a lot of bit of motivation. I'm going to add one thing that I think we were able to put our energy towards was thinking about, okay, what is something that we could do that makes the exposure irresistible? For my child to be like, I can do that, so it almost outpaced the fear, which was like, okay, we're gonna have a food fight, and we don't care how messy you mess the house, or you can spray us with water, or you can throw flour all over the house, or
oh,
you know,
what?
we
I
don't
know,
mind
That would have
you.
been awesome.
Oh my God, we'll do
Right,
it.
we're gonna bowl for chemicals. The other thing I'm gonna say is sometimes if your child likes art or drawings or pictures, making the thing that's scary funny or ridiculous. And so I'll just say fart shoes. If you can take something scary and suddenly it has fart shoes, then it loses a lot of its fear and power. Thank you all for your help this hour. Thank you all and happy holidays. Let me just close up by saying you can join us to help improve the lives of those affected by OCDs and related disorders by joining the IOCDF. We are, there's membership options, and we would love to have you join our community and participate in live streams. Your support will help shorten the time it takes for those suffering to get support they desperately need. So this is a time of year for giving back, and we appreciate any donation. Your contribution to the IOCDF, you can go to iocdf.org/give. It will fuel vital resources, education, researches, live streams like this, and help build our community to unite those who are looking for treatment or are ready for treatment, and meet those who are also fighting against obsessive compulsive disorders and related disorders. One thing that the IOCDF is working on is you can help us reach our goal of raising $300,000 before the end of the year. That's December 31st. So if you could contribute anything you can right now, would be iocdf.org/give. We appreciate any donation, and it will help give back to this community. And also, lastly, thank you, Jack MHA, for their dedication and support. And thank you to Victoria, Sydney, Kyle, and Jesse for joining me tonight. Happy New Year, everyone. Good luck in 2025. And thanks for all your support in 2024. We'll see you in about a month for another live stream.
Thank you, everyone.
Thank you for having us, Chris.